Hi, I'm Dr. Pradeep Kumar, Senior Consultant Rheumatologist from Narayana Health, Bangalore. I'm here today to talk about rheumatoid arthritis. I'm a rheumatologist. The reason why we are called rheumatologists is because we are experts on rheumatoid arthritis. Rheumatoid arthritis is a very modern condition. There is no ancient documentation or fossilized evidence for rheumatoid arthritis. So the earliest record we have is only in mid-19th century. So it's really a modern disease, and I believe that our modernization and urbanization is the biggest risk factor in developing rheumatoid arthritis. And that is why in India, the incidence is rapidly growing because we are rapidly becoming urbanized. Rheumatoid arthritis is not equivalent to the common terminology which we use as arthritis, which usually relates to osteoarthritis, which is usually seen in older people. Rheumatoid arthritis can affect any age groups, and in fact it can affect even children, where we call it as a juvenile idiopathic arthritis. So it can affect any age groups, but more common in women than in men. This condition can be quite crippling, and more than that, if patients develop rheumatoid arthritis, they can die earlier. If you get rheumatoid arthritis, it is almost as similar to developing diabetes. But everybody is aware that if you get high sugar and diabetes, you're going to die with heart attacks. But that is the same, exactly the same with rheumatoid arthritis as well. So it is not just for treating the pain, but we also want to make you live longer. And for that, it is extremely important that you see the rheumatologist as soon as possible. We call it a window period. The sooner you see us, there is good chance that you're going to live longer and you're going to live without pain and disability. Rheumatoid arthritis causes a lot of disability, and it predominantly affects the hands. Most of our functions are based with our hands, and it does limit us quite significantly. I'm sure one of you would have realized that even sometimes when you have a small injury to your little finger, that's when you realize that how much you need a little finger. But this condition affects almost all the joints of the hands. So it does limit you significantly. How will you recognize this earlier on? Mostly we rely on this stiffness of the joints, especially the hands, in the mornings. So in the morning when you wake up, and if you feel that your joints are stiff, especially in the hands, then you have to think that you are developing some kind of arthritis which is more than the normal osteoarthritis. And you have to see a rheumatologist as soon as possible. Currently, we have excellent treatment for this condition. In fact, we are talking about near cure. Until about a decade ago, we didn't think of a cure for rheumatoid arthritis, but now we are talking about near cure. Even near cure, some patients are not accepting it, but take a scenario like in diabetes. Currently, there is no cure for diabetes, but we still follow all the instructions given by the doctors. But in rheumatoid arthritis, we are talking about near cure. The earlier you start the treatment with special medications, what we call as either disease-modifying agents or biologic agents, there is extremely good chance that you can come off the treatment after about a year and remain pain-free or disease-free for a longer period of time. This is what we call near cure. If we don't get a near cure and if you present to us a bit late, we can still give you almost normal quality of life without any limitations. These drugs are quite novel and excellent. So sometimes we believe that novel treatments are riskier, but I always give this analogy of a novel technology. In technology, we use lots of novel ideas. We try to get Mercedes-Benz instead of your Maruti. But in medicines, we always have this fear that novel medicines are riskier. Actually, it is opposite. Medicines are also made of novel technologies. And with the novel technology, the safety is quite high. So there is never a guarantee that it can never cause problems. But the safety is really, really good. These are the biologic treatments I'm talking about. They are a bit expensive, but the cost is coming down. India being a leading manufacturer in the world, with more and more companies manufacturing all these novel medicines, the cost is coming down significantly, and most of the patients are now becoming affordable in taking these novel treatments, and that is causing near cure in them.